Hi guys, and welcome back to my YouTube channel. If you've been following my series, that's my pregnancy series, my twin pregnancy, how I got to know I was pregnant, how I got to know it was a twin pregnancy, to my cesarean section story. And my last video I talked about my pre-cesarean section story. That's preparing myself mentally, physically, and financially. So in my last video, I didn't mention the financial part, so I'll mention about it briefly. The financial part, the money for cesarean section can delivery generally in Nigeria, it's a whole lot of money. Then cesarean section is actually a whole lot of money, depending on the clinic that you have. There are levels of clinic and their surgeries, the surgeon and the instrument they use. So for my own cesarean section, I work with a company where our health care is being sorted by an HMO. So that covered my cesarean section financially. So all I had to do was prepare myself mentally and physically. And by physically is the same preparation for the vaginal birth. I'm going to make a separate video on what my labor bag contained of, and it was same thing as my when I was going for a vaginal delivery. So today I want to talk about the cesarean section itself. My last video I mentioned how I fell into labor already and we had to go and drop off my son in school that morning. That was around 6:30. After we dropped him off in school, we drove straight to the clinic and the nurse checked my vitals. Meanwhile, my mom was around, but she stayed back at home while I and my husband went to the clinic. We went with our bag, of course, because it's delivery time o'clock. So we got to the clinic, they checked my vitals and start calling. Once I was done with the vitals check, I was referred to general doctor. Then once he heard that it was a twin gestation, I was like, why were you booked for an elective CS? I said yes, but that was till Wednesday. So they had to make a call in the surgeon. As I said, the guy that I had encounter with initially was not around, was on leave. And so they had to call Dr. Adekonye, shout out to him. He came over, the pediatric, the nurses, all hands were on deck. I was admitted into the room. They were trying to put in the cataract. I'm not sure if that's correct. I'll try to get the name. Insert into my vagina so I'll be able to pass in urine directly into it. Well, I watched Sisi Yemi's video where she said it wasn't painful but was not comfortable. Like I said, I tried to go into my experiences prepared. So I already watched some videos. Within the short time I knew I was going to do the cesarean section. I have a cesarean section. So to me, a discomfort is already a pain. So I would say it was painful to me, but it not be painful to you because the doctors were accusing me that I don't have threshold of pain. I be clinical. Anyhow, so I don't mind. So that was sorted. The ladies gave me the anesthesia, put me through what not to do, what to do, and which the major one was I should not raise my head while being given the injection, or after the surgery I have to wait for like 24 hours before I raise my head. Now I'll tell you the repercussion of that later, because while I was being given after the prehem and everything, I was wheeled into the theater. When we got into the theater, my husband was not allowed to enter because they don't want because of emotional attachment, they don't allow family members, so he was outside. So I just told him, see you soon, Baba, see you soon with your babies. So we got in and they started trying to work on my, while the surgeon was trying to mark where he's going to open up, the anesthesia lady was trying to inject my spine. While she injected one of my spine like this, I felt the shock. I don't know when I shouted and raised my head. She was like, I told you not to raise your leg, but this thing is painful. I had to instruct the nurse. Now you know this thing is painful. Like normally I would react because I'm human. Come on. You will have held my head down and put in the injection so I wouldn't actually feel the pain, or I won't have to raise my head and avoid the repercussions. So she had to hold my head all through. She injected me and she was talking me through the process while they opened up my abdomen to bring out the babies. So I wasn't feeling pains again. My legs down were numbed. I was talking, we were communicating, they were teasing me on how to come back with pregnancy of triplet. I say it's not me and them, I beg. So we're talking all through. We're conversing. At the point I was feeling a bit dizzy, but I was encouraged not to sleep. So we went over the conversation, why the surgeon and doctor that were assisting him were carrying on the surgery, because of course it's a major surgery. So once they brought out the first baby, that's the leading twin, I felt the pressure off my body, but there was no pain whatsoever. Then the second baby, and they started stitching me up. The process wasn't up to 30 minutes at all. It wasn't up to 30 minutes. And so the baby were older than each other with just 3 minutes, about 2 minutes, something like that. So we brought out the babies, and then I was being closed up. The surgeon was communicating. He was communicating the way that I was being carried along myself. Even though I could not see them, there was a barricade to cover my stomach down, or should I say my waist down? No, my stomach down. So I wasn't seeing what was going on down there, but I was communicating with the other doctors, and we were catching fun and teasing. They were teasing me. I wasn't teasing one another, but they were teasing me. So that went on like that. And once it was, you say, returning the uterus, doing this and that. So I knew as it was going. When he closed up the abdomen, I was wheeled back into the admission room. I was laid down there for the next 24 hours. Now, because I raised my head, there was a repercussion. But then you have to watch out for my last episode on my cesarean section, where I'm going to talk about what happened when I raised my head, and when I started feeling the impact of raising my head, and so on. Subscribe, you know what to do. Like, engage, comment, ask me questions, make them as a video if need be, or make them as a short anyhow. See you soon. Bye.